We've made a promise to our patients to provide them excellent and outstanding health care. The largest portion of what really impacts health of our population are really within the social determinants. Healthcare itself may be about 25%, but about 50% of it is the neighborhood someone lives in, their access to work, their access to fresh air, their access to walkable neighborhoods. These are issues that propel us to look at social determinants of health, recognizing that we may have the best opportunity to improve the overall health of our most vulnerable populations by focusing on these issues.
LA Care was doing social determinants of health for a long time. What we were looking for was to really centralize, coordinate, and prioritize these areas. The advisory board was actually very, very helpful to our initial learning. One research and paper in particular helped us identify that a lot of the resources are actually out in the community, while really leveraging local, state, and federal resources, and also our community-based organizations. So strengthening those partnerships is what we are looking to do first before we created these whole new initiatives at the health plan. And now we're really looking at, what's working and what some quality outcomes could be as we look at this area.
In terms of the changes we've made to address social determinants of health, I think the first and most important change is going on right now. It's a change in sensitizing our own staff to the needs of social determinants of health. Training, talking to folk, giving them reading material, inspiring people to understand that this is our mission. It's not just something we're doing on the side.
The most important shifts was, again, getting everyone from our consumer representatives that talk to the members on a daily basis, even to our, upper leadership, to get them all on the same page about what social determinants we're focusing on and why it's so important. So we looked at housing, food security, income security, transportation, and early childhood education. We really think those are the most important social needs to focus on.
The second issue is trying to find the right resources and the right partners in the community to help us. We don't believe that LA Care can do it by itself. So we have to partner with other organizations, other health plans, provider groups, philanthropies. And so making sure we can build those alliances and purposely work for our population. We're talking to other people in the community about what we can do and how we can do it better. We have an organizational structure that brings in people from the community who meet with us on a regional kind of basis, and they feed into our thinking around what's the best thing we can do to support our community. So it's an ongoing process. It has to be nurtured. It can't be taken for granted.